once the embryo transfer has been carried out, you're of course eager to know whether you've actually conceived or not. And the best method to find out whether you're pregnant or not is to do a blood for β-hCG around 14 days after the embryo transfer has been carried out. There are three alternates to checking whether you're pregnant or not. Doing a urine pregnancy test, which is quick but not always reliable, especially so early in the pregnancy, or an ultrasound, which is again confirmatory, but that shows up as a pregnancy a much later, maybe 2 weeks later from today. So the best test to do is actually a blood for β-hCG, and that also should be done around 2 weeks post embryo transfer. See, the embryo that has been transferred in your womb is usually a day 3 embryo or a day 5 embryo. It has to continue to grow for some more time in the womb, and then it will stick to the womb lining. Once it is stuck to the womb lining, called implantation, it will start secreting a hormone called β-hCG, which will then get mixed with the maternal blood through the connections that have formed between the embryo and the maternal uterine wall. This hormone will show up in the maternal blood test only after if it's reached a particular level. Usually this happens only about 7-8 days after the embryo transfer has been carried out. But we still like to wait for another 4-5 days and do the test 12 to 14 days post embryo transfer. The reason for that is very simple. Historically, we have done the test at that time, and most of the data that you would find on the internet also relates to values obtained at the time of embryo transfer. So if you check your blood levels on the internet values to find out whether yours is a good value or not, you will make mistakes if your value has been done on the 8th or the 9th day and internet is discussing values which have been carried out on the 12th or the 14th day of the transfer. So stick to the standard, get your blood test done on the 12th or the 14th day of embryo transfer, and then go on net and find out whether yours is a good value or not.